There are 5 keys to a successful case. Let's review them. The first one is defining your goals and the patient's chief complaint. This may sound like basic advice, but it has been our experience that this may be overlooked when submitting a case. Questions that you need to ask yourself before submitting a case are: is the focus static, functional, or both? Is the patient stable in their current occlusion? And so, do I really need to proceed with class correction? A great example is shown right here. Both of these are class 2 patients, but the way we're treating them has different goals, with one being class corrected and not the other. We will discuss more in a dedicated video. The second key is good diagnostic records. In this series, we have videos dedicated to this for a good reason. Poor records will lead to an unpredictable treatment and refinements, so extra treatment time. Depending on the record's quality, the trace may not even fit. Since staff is usually the one acquiring these records, I highly suggest having them watch the pertinent videos. The third key is clinical preferences and your prescription. If you go to your doctor's profile, you will find the clinical preferences section. Here you can set up directions that you want followed for every case. For example, this doctor would like to place attachments on step 4 for all of his cases. If you complete this section, this will save you time. Also, please make sure you're clearly filling out your prescription. Show it to your staff so they're familiar with it too. Furthermore, make sure to let the technician know of your goals. Sometimes writing "resolve crowding" is enough, as long as that's all you're looking to achieve. But if you want to correct glass, achieve space for an implant placement, or any other specific goal, it is important to let your technician know. Also, please always read the comments from the technicians so you can be updated on your case. The fourth key is following good protocols for attachments and IPR. We have confirmed that the second and third most common reasons for refinements are lack of proper clinical protocols in these areas. These pictures show poor quality attachments and also IPR. We have dedicated videos in this series to these protocols too. Once again, please share them with your staff if they are responsible for any of this task. The last, but equally important key is patient compliance. This is actually the #1 reason for refinements and cases not tracking. It is important to discuss this with the patient during their first visit, as you need to make sure they are aware and can comply with the treatment. Aligners need to be worn for 22 hours per day for 14 days to yield the best results and minimize refinements. On a separate video, we discuss the physiological reasons for this.